Now to the coronavirus pandemic and the newest numbers in our region. There were 108 new hospital admissions today. The total number of COVID-19 patients in area hospitals is now at 961, a record since the start of the pandemic. There are 202 COVID-19 patients in the ICU and 123 patients on ventilators.
We are joined live now by the head of the St. Louis Metropolitan Pandemic Task Force, Dr. Alex Garza. Dr. Garza, during your news briefing this afternoon, you gave us an update on these numbers, and if these numbers don't go down now, you say that hospitals could soon reach capacity in about a week. What happens if our area reaches, or rather when our area reaches that capacity?
Yeah, so we're going to be looking on how we can increase even more capacity. So whether that is converting different parts of the hospital to our intensive care unit, cutting down on the other services that we provide, pulling resources from our ambulatory or outpatient care to do inpatient work, anything that we can do to create more space and more staff to take care of these patients. And then as you go farther down the line, then you have to think about, okay, now how do I alter the care that I'm delivering so I can do the most amount of good for the most amount of people, or what we call crisis standards of care. So we'll try and increase that capacity, but even that has a limit. And then post that, then we got to think about how can I take care of the most amount of patients with the staff that I have.
Dr. Garza, the patients that are being admitted, are they from our area, or are they outside of this area, or both?
They're both. So the majority of our patients come from the St. Louis metropolitan area. So out in Franklin, Jefferson, St. Charles County, St. Louis City. But what we're finding is that we're seeing more patients coming in from the rural areas as well. So all of those counties outside of the metropolitan area. Most of those used to come by transfer, but what we're seeing now is a trend of ambulances coming directly from those counties to our emergency departments. And so what we're seeing now is even more patients coming in directly from those communities and not necessarily being admitted to those rural hospitals and then transferred into the metropolitan area, which it's concerning.
For people out there who traveled over the Thanksgiving holiday or who gathered with a larger group of family and friends, what would be your advice to those people?
Yeah, so the probability that you were exposed to the coronavirus in gathering in a group or traveling is fairly significant. And so the advice is to self-quarantine up to 14 days or go and get a coronavirus test, usually after around 5 to 7 days. And the reason for that is quite obvious. We have a lot of virus circulating in the community. Your probability of being exposed if you're in a large group is pretty high. And so if you were engaging in some of that activity, protect the rest of the community by doing those two things.
And Dr. Garza, one last question real quick. We're seeing this surge. We've also heard about immunizations that may be coming by the end of this year. Is this surge going to decrease this year? When do you feel like that it's going to finally end?
Yeah, it's hard to say. A lot of it is dependent upon how much transmission is occurring out in the community. And so we take a look at our models every week, and those change their dates, and it changes the peaks depending upon what we're seeing out in the community. So, right now we're modeling it at the end of December, sometime in January, depending upon what the transmission looks like. But I will, reference back to your comment about the vaccination. Vaccination for the general public isn't going to come really until maybe first, second quarter of 2021. So although we're very excited that vaccine is on the way, we know we're going to have to live through this surge in patients before we even get close to vaccinating enough of the public to create herd immunity.
All right, Dr. Alex Garza with the St. Louis Metropolitan Pandemic Task Force, we thank you as always for your time and for sharing your information and expertise with our viewers this evening.